Welcome to Bonafide HPP, a podcast designed to educate and support the families and caregivers of those affected by hypophosphatasia. As a mother and caregiver, host Deborah Fowler has discussions about this rare genetic bone disease with people from around the world. Join Deborah now as she speaks with this week's guest.
Hi, I'm Cindy Reasor. I'm the project coordinator for Soft Bones, as well as a patient, caregiver, and advocate. I'm sitting in for Deborah Fowler today. Today's guest is Alison S. Alison is a hyperphosphatasia patient, advocate, and certified health and wellness coach. May is Mental Health Awareness Month, and today we will be discussing the impact of stress, mindfulness, meditation, and exploring how these factors can influence your well-being. Thank you so much for joining me today. And why don't you tell our listeners a little bit about yourself?
All right. Thanks so much, Cindy. It's a pleasure to be here, and I'm so grateful for the opportunity. So, as you mentioned, I'm a hypophosphatasia patient. I also have some other chronic illness as well in terms of some high blood pressure, heart arrhythmias, and some other conditions that I've been living with for a number of years. In addition to that, as you mentioned, I am a certified health and wellness coach as of recently, and really look forward to helping people through chronic illness and managing that and helping to improve outcomes, as well as lifestyle management. So making any changes in their lifestyles and then helping people through life transitions. And as part of that, that is in alignment with also my other business, which is a business advisory working with women-led startups in health, wellness, and lifestyle. In addition to that, just because of all the health that I've been kind of surrounding by, I'm also a spoke member of ARPA-H, which is the Advanced Research Projects Agency in Health, which is a division of the of NIH and the Department of Health and Human Services. And that is to advance innovation and research within health. So I'm really excited to be here, and thank you again. Look forward to our conversation.
Well, thank you so much. And it sounds like you are a very busy lady. I'm really excited to talk about these topics today. I think it's an area that we, as patients, really need more encouragement and information with. So let's start off with stress. Living with a chronic illness involves numerous stressors, and we know stress can manifest physically in various ways too, affecting the body on multiple different levels. In addition to the physical challenges, there's also significant mental stress stemming from the factors of all your diagnoses that come in, the financial burdens that go along with your copays and your prescriptions and missing work and things like that. And then we have the lovely complexities of navigating the current healthcare system. So the mental stress can in turn have a tangible impact on physical health. What are the different ways that stress can actually affect us physically?
Yeah, absolutely. Well, first, I'd love to also just kind of look at the landscape right now, like what is happening with stress and American adults. And so, really, in looking at a recent survey that's been done in 2023 by the American Psychological Association, they they surveyed US adults, and they found that to asking them on their average level of stress on a scale of 1 to 10, with 10 being the highest. And the average was found to be about 5, which is a pretty good number. Yet, a quarter of adults, so around 25%, though, rated their average stress between a level of 8 and 10, which is pretty high. And that is up from 2019, so before the pandemic. So in 2019, that was around 19%. So we are seeing an increase in general in the landscape in the United States of adults being more stressed. And I think given also chronic stress, given the length of the pandemic, as well as you mentioned earlier, financial factors, right? The state of the economy and people's finances, as well as there's some other contributing factors as well. And so when we think about how stress plays out in our life, stress really puts the body on high alert. And chronic stress over time, so constantly if the body is on high alert, that is where it can cause some really debilitating effects. It can weaken the immune system, it can cause inflammation, and it can also produce chronic illness as well. And so it's really important to recognize what's happening with the body. And you can physically see those symptoms or sense those symptoms. And so just some of the ways, quickly, breathing is one. So usually when you're stressed, you might have a shortness of breath. It also might be rapid. So you might have a shallow, you might not be really breathing deeply in your diaphragm and in your belly. It might just feel a little bit more concentrated in your chest. And then also you could have some difficulty breathing. So stress can trigger panic attacks, which can really lead to difficulty breathing. And so that is one way. And then also, relative to HPP patients, right, on the musculoskeletal system, it really stress puts more tension on the muscles, creates more aches and stiffness in the joints, which is also really important for HPP patients to help manage that stress so that they don't get increased symptoms in that area. In other ways that physically stress can affect the body, it can produce headaches. It can, again, increase your heart rate. It can increase your blood pressure, which is also, detrimental and can create some downstream effects, right? There can also be sleep issues, and digestive issues as well,
Wow,
among other. Yeah.
really profound impacts. So, do you have some effective strategies for helping people manage their stress?
Yeah, and so there's this book that I've enjoyed reading, and we're going to talk a little bit about it, I think, during our conversation today. But talk about two different strategies for stress. And so one is what's called like a stress reactor, or reacting to the stress. And this is really it's an automatic stress reaction. You might know it as called the flight or fight syndrome. And so that is not a healthy coping stress mechanism, because that actually is what starts over time. If you start reacting to stress, and that's what happens, is your flight or fight gets activated over time, that produces this chronic stress. And that's what also helps leads to producing chronic illness. Instead, what this full catastrophe living book suggests is really having a stress response, which is a more healthier coping strategy than a reactive. So it's responding to the stress versus reacting. And so what they talk about with this stress response is just really bringing awareness to what's happening in a stressful situation. And what I mean by this is almost like creating a pause and really pausing to notice your thoughts, your emotions, and sensations. Um, and so we'll get into that a little bit, but when you do this, it really changes the dynamic of the situation and really gives you options on how to influence what will happen next, because it's a way that you can change your response to the stress versus just basically flying off the handle to it. And so you end up shifting how you are in relationship to that stressful experience. And when you create that awareness and you create that pause, it really allows you to have a moment to assess things more completely and possibly in a more calm manner, and maybe with a little bit more compassion. And so the way this kind of works is that if a stressful situation happens, let's say you're in a traffic jam and you have somewhere to be and you're running late, something like that possibly. If you just remain centered in the moment of that stress and still recognize the stressfulness of the situation, and also recognize what would be your impulse to react, you do introduce like a new dimension to the situation. And so you really can think about, well, identifying what's going on. What is that thought that's happening? How does that feel in your body? Or what's that emotion? And then how does that feel in your body? So another example is, um, with that framework of thoughts, emotions, and sensations. Let's say you are walking at night and something feels not right. You don't feel safe in your environment or something. So your thought might be you feel threatened. Then emotion might be you're fearful. And the sensation might be you get tense, your body tenses up. And so if you can kind of bring awareness to um, maybe like your shoulders as they're tensing up or your jaw that is clenched, um, any kind of stressful sensations, if you can just pause and come back to your breathing and notice your breath. Maybe you're taking one or two, notice how the breath is happening within your body. That allows you to like reconnect with calm and awareness. And then what happens is it reduces the power of the stress reaction and its hold on you. And it allows you to maybe respond more mindfully. And when you respond more mindfully to stress over time, you may notice that things that used to push your buttons, like a traffic jam, maybe they don't any longer. Maybe they're not as stressful. Maybe you're going to get to where you need to go, and it doesn't bother you as much. And also too, relating to chronic illness, using this stress response method of pausing and being aware of those thoughts and emotions and sensations, it can really help you better manage your pain. It can better also help you concentrate as well.
That's great information, and kind of getting into being mindful. So one technique that we frequently discuss is mindfulness. So initially, when I was first introduced to mindfulness, I thought it was somewhat unconventional, not for me. And I did go ahead and give it a try because I had to. It was part of my pain management strategy. So I had to try it. And as I continue to explore it, I did find one technique that I regularly use now. So I've come over to the other side.
Oh, that's wonderful.
Please tell our listeners a little bit about the purpose of mindfulness and how they can institute it into their day.
Sure, yeah. Well, I think what I'd like to do is just start off with like the definition of mindfulness, so everyone's kind of on the same page and really has a greater understanding. So last year, actually, I took a course with UCSF, so University of California at San Francisco, their integrative health department. They had a course on mindfulness stress-based reduction. It's a mouthful. And so we really got to learn a lot of like the basics and the fundamentals. And it was led by a wonderful teacher. And she had previously been, I believe, an occupational therapist or a physical therapist, but she had been in the medical field herself. And a lot of the participants in the class, like myself, were going through some sort of chronic illness. They were dealing with some sort of chronic illness, whether they previously had cancer or a back injury or other. And so this practice really did help us gain a greater understanding of how we can cope with that. And I would love to just kind of talk about the definition that UCSF provides around mindfulness. So they say that mindfulness is the moment-to-moment, non-judgmental awareness. That again, that moment-to-moment, non-judgmental awareness. And that's really, to them, they see that as the purpose of the mindfulness practice. If you look at some of maybe dictionary definitions, according to the Cambridge Dictionary, mindfulness is really the practice of being aware of your body, mind, and feelings in the present moment. And it's really thought to create more of this feeling of calm. It's kind of what we were kind of talking about a little while ago. But overall, regardless of the definitions, mindfulness does help reduce stress, using your breath and staying aware in that present moment to produce calm.
So how has mindfulness techniques helped you cope with your chronic illnesses?
Yeah, I think it's so many different ways. I mean, I would say definitely being aware of the tension, um, and knowing when I feel stressed and going back to my breath and concentrating on that breath so that I do feel more calm. It's helped me a lot with focus and concentration, which is, of course, like I think some patients like myself struggle with hypophosphatasia. As hypophosphatasia has progressed over the number of years, I've definitely found myself being easily distracted. And the mindfulness practice really helps me kind of come back and concentrate and with more clarity, to be honest. It's also helped me really lower my heart rate, um, which I already struggle with high heart rate as well. So it really helps to kind of bring that down and create that calm. And I think at the end of the day, it just helps me be more aware also of like what's happening around me and that intuition so that I can navigate situations a little better. Um, and I would say that's kind of mainly how it's helped me.
So the technique I have been using, I believe you call the body scan meditation. So it helps me gain a clearer understanding of what my body is actually experiencing on a daily basis. I'm not going to go into too much detail here, but I focus in on every single part of my body and I work my way up from my toes to my head. And it's amazing to me how many different parts of my body are actually hurting or tingling or numb that I'm just not even recognizing. And so I'm going on, and I've heard where the brain processes pain signals before it processes anything else. So that kind of explains to me in theory why I struggle with the brain fog and the confusion and things. I'm like Dory the fish. You get me talking and I'm off on 500 different topics. So what recommendations do you have for patients who are new to practicing mindfulness? Like, I know I went in with a really bad negative attitude. So, if you could just kind of expand on what can kind of give you the right attitude going in.
Yeah, yeah. First of all, I love to hear that you were doing the body scan meditation because that's fantastic. And that's one of the ones that we've learned in our course that I was mentioning. And so it's a very helpful meditation, and I'll be mentioning a little bit more about it towards the end of this end of our segment today. But um, I'm glad to hear that that's also worked for you, and that's been helpful for you, to understand, like you mentioned, where you have pain in your body, and also maybe even helpful. It sounds like it even helping possibly fall asleep as well at night and feel more rested.
Most definitely. I usually fall asleep by the time I think sometimes I get to my collarbone, but I'm out before I get all the way done.
That's great. Yeah, so it's definitely doing its job and relaxing and producing that calm. Well, for new patients, for people that are new to practicing mindfulness, I'm going to walk through some of the foundations of that, but at the end of the day, it's really about having this attitude, like an open-minded attitude to approach it. Um, it's which is really important because it really influences the long-term value that you'll receive from it. And also too, it's also helpful to have a certain level of energy when you're starting the practice. So if you come and your energy is really low and your attitude of commitment is really low, then it might be hard to develop that consistency and practice with relaxing as well, because that's also really important when we're doing mindfulness, um, through either meditations or breathing exercises. Um, and so again, the attitude is just really crucial to remain open. And so in this book, The Full Catastrophe Living, which is a book about using the wisdom of your body and mind to face stress, pain, and illness, they do mention that there are really 7 attitudinal um, attitudinal factors for mindfulness that really all work together. So I'll just high level talk about those 7, and then I'll probably maybe go just a little bit touch deeper on maybe about 4 out of those 7. So the first is non-judging. Really paying attention to the moment-to-moment experiences while not getting caught up in ideas, opinions, likes, or dislikes. So I'm going to go in a little bit more detail here in a little bit on that. The next one is patience, making sure you have patience with yourself. It's a new practice, you're learning something. And then with that, having that beginner's mind. So almost like having an open mind. It's just you're trying something new. Just experiment with it, right? See how things can be. Trust is another one, is another factor. So really just being able to trust in yourself and honor your feelings and your body. Non-striving. Um, I think that's this one's probably the hardest for me. And I would say for a lot of people, because, you know, in society, we're always rushing to try to do something. We're always trying to, try to be somewhere, try to finish something up, try to pack as much as we can in the day. And the aspect of non-striving is just being there, just being present and not and letting go is also another one too. So that's another factor, is really letting go of those thoughts. And then lastly, acceptance. Um, just accepting how you're feeling or what you're thinking. And so if I were to go a little bit deeper into those maybe 4 that I would pick would be non-judging is also a really big one, and kind of hard for people as well, because if you watch your thoughts during the day, and I really encourage people, actually, patients on this podcast, to really watch your thoughts that are happening. Count up maybe how many negative thoughts to how many positive thoughts you have in a day. It's amazing how many thoughts we have in a day overall, but also even the negative thoughts. And so what non-judging does is it really, when you don't get caught up in categorizing the ideas, like labeling it by the mind, like thoughts that come across. So maybe there's something that a person or a thing that actually makes you feel good. And so you might judge it as that's good, right? You might say that person's good or that thing is good. And then there might be some things um, like the news or other that you might categorize as bad, whatever it might be. And so the thing is that is judging, and you don't want to do that, because that really can dominate the mind over time. You're thinking about those things. And so what you want to do is you want to relax and just be aware that you're thinking that. So you don't need, when you find the mind judging things, people, events, you don't need to stop the judging, but just be aware and watch those thoughts, but not act on them. So just kind of watch them pass by, almost like they're drifting by. Um, and then, another one, of course, is, I think patience and that beginner's mind actually kind of go hand in hand together. Again, really just giving yourself permission and room to experience and to just be there for that practice. So you don't need to try and fill those moments with more thinking or activity. It's actually more simplified than that. And then I'd say that, again, going back to that non-striving, is really what they say is, in meditation, the best way to achieve your goals is to back off from striving for results and instead focus carefully on seeing and accepting things as they are, just moment by moment. And over time, with patience that you have for yourself and regular practice, movement toward your goals will actually take place by itself. So you're not forcing anything, right? That's what that's talking about, is you're kind of, and that goes back to like letting go, right? Those are almost intertwined together. You're just letting go, and paying attention to those thoughts. and the acceptance. So this one's too, I think, is really important for people with chronic illness. So it's really seeing things as they are in the present. So if you're tired, just accept that you're tired. If you have pain, a lot of chronic pain in your joints, your bones, notice that you do, accept that you do. Don't um, don't spiral in the negative thoughts, but just accept that you're in pain, and accepting what is before you can actually change and create the preconditions for healing. So it's really important to get to that acceptance so that you can really begin to heal. And you can think of that too, if there's like they talk about the 5 stages of grief, right? And acceptance is kind of one at the end. So it's really not trying to impose what you should be feeling or thinking, but just being open and receptive to how you are feeling and accepting that you are in pain. So I'd say those are kind of like, that's what makes up that attitude of like having that mindfulness practice. And
Well, that's so interesting because I've actually been doing some of this on my own and didn't even realize that I was doing these techniques. So I've been working on another project, and I've been talking about the stages of grief when you have a new fracture or you have a new diagnosis, and you do have to let yourself grieve, but then you have to move on. And I've said these words at least 50 times in the last 3 days: accept, adapt, and overcome. And you may not overcome 100% to where you were, but find how you can overcome and be present in what you're dealing with and make it the best that you can. So that's very interesting. I'm learning right along with everybody else, and it was eye-opening to hear these words and the explanations of them. I'm already doing some of this.
fantastic. That's wonderful. It's wonderful to hear.
So, do you have any techniques that you could actually guide us through that we could kind of do while we're on the podcast ourselves to see if it's helpful?
Yeah, absolutely. So what we can do is we can go through a breathing exercise. And before we go through it, I'd love to just give folks maybe some examples of 2 different breathing exercise. So, and also too, I think the thing is too with breathing, these little exercises or meditations, if you will, um, it doesn't have to be super long. You can do a 3-minute, 5-minute breathing exercise, and it will really help to just reset the mind and calm things a little bit. I do this actually a lot with my clients in health coaching. Before we begin our sessions, we take what we call a mindful moment, and we do I typically do the box breathing, which I'm going to mention, exercise for some rounds, and we only do probably about 2 minutes or 3 minutes, and it really helps the clients kind of get into that open mindfulness aspect before the session. So with this, again, I think there's 2 good ones. Box breathing is a great practice. What it does is it encourages slow, deep breathing, and it really helps to calm the nervous system, reducing stress and anxiety, and help clearing the mind to provide that focus. And then I'm going to talk about the other one, and then we'll come back. Well, I think what we'll do is you do the box breathing in today's segment. And then there's diaphragmatic breathing or belly breathing. And what that is really like slow, deep breaths that engage the abdomen. And those really promote relaxation, stress reduction, and just overall well-being. And with that, people could do, just if I would give people a technique that they can use on their own, because a lot of people really love the belly breathing. I know that one's a little bit harder for me because I do find myself having more shallow breaths, like breathing. I feel my breath more in my chest than I do in my belly, but some people do feel it in their belly more. But it's really when you place one hand on your chest and the other on your stomach, and you really just breathe in slowly through your nose, allowing your belly to expand while keeping your chest relatively still. And then you're going to exhale slowly through your mouth, feeling your belly contract. So if people want to do that breathing exercise, they can also have this as an example to do on their own. And I would say that maybe you want to go through and do that. You could time yourself. You could go through and do that for 3 minutes or whatever feels right for you, 5 minutes. And just feel the breath and really concentrate on the breath. And I think that that will really help people gain some more calmness. And so another technique is what's called the boxed breathing, which we talked about. And so I'll walk through people through this technique, and then we'll go in and do one if that's okay. And so what you're going to do is you're going to just inhale slowly to a count of 4, and then you're going to hold that breath at the top for a count of 4, and then you're going to exhale slowly for a count of 4, and then you're going to hold that breath again for a count of 4. And then you're going to repeat that cycle. And so, and I can say that again if it's, so you're going to inhale slowly for a count of 4. You're going to hold your breath for a count of 4 at the top, which is hard sometimes. And then you're going to exhale that breath for a count of 4 slowly, and then hold for a count of 4. And typically I would say you could do that in a cycle of 4 or 6, I think is enough, at least just to get you going. You can always go longer as if you want. And so right now, if we want, we can begin, if that sounds good for you.
Yes.
Okay. All right. Well, I'll go ahead and lead us on. So we're going to inhale slowly. We're going to hold. And we're going to, for that count of 4, and then we're going to exhale slowly for 4. We're going to hold at the exhale for 4. We're going to do 4 more cycles of that. We'll go ahead and keep going. Then we'll come back when you're
That was
ready.
nice.
It was nice. Okay, good.
Yes.
Do you feel any different?
I do feel a little bit more calm and actually a little less tense in my top of my shoulder areas.
Okay, great. And you have access to that. I think that's the thing, is everyone has access to this. It's our own breath, but it's really being able to take the pause out of the day, wherever you may be. And the thing is you can do this in the car. You can do this at your home. You can go into the bathroom and do it if you need to. There's all types of places and locations that you can do this. It's just accessible to being able to provide that calmness.
It's been great. So I hope our listeners have found this information as helpful as I have. And thank you so much for joining me today and sharing your professional insights and your personal experiences. But before we wrap up, is there any final piece of advice, thoughts, or resources you'd like to leave with our listeners?
Sure, yeah, absolutely. So I think one was that body scan meditation that you mentioned. So there's a lot of different meditations out there, and I think the body scan is really helpful for a lot of people dealing with chronic illness. And you mentioned yourself how it had helped you, and so it is. You can find it on YouTube. There's probably a lot of different versions on YouTube, but if you search for the body scan meditation, you can find one. And then I would just find the practitioner that you really enjoy their voice is important too. That maybe like you respond well to their voice, that you would be able to sit there and do the meditation. I will say that meditation is a little longer. So I will say that because you, as you mentioned, Cindy, you're going to these different parts of your body and you're spending time being aware of those from your toes all the way up to your head. And so it can be about 40 or 50 minutes in length, that meditation. But there's some great ones actually out on YouTube, whether it's the body scan or some other meditations that are a little bit shorter in length. But I think that that is a fantastic one for people to start with. I'd also say, if people are not doing yoga, yoga is really helpful for mindfulness because you do concentrate on your poses and your postures, and you really understand and are present about how your body's feeling. And if it's not feeling good in a certain pose, you don't have to do it. It's about honoring your body. So I think yoga is also a great practice if people want to start also maybe lightly getting into meditation or mindfulness as well. It's kind of a more of a exercise path through that. Um, and I think it also is great for hypophosphatasia patients, right? And just kind of loosening up the body as well. And I would also say if there's some books people would like to read, um, there are a couple that I have that I would recommend. I think one, just easing people into mindfulness a little bit. There's one, it's called The Book of Awakening, and it's by author Mark Nepo. And it is a New York Times bestseller. And really what it is about kind of the premise is having the life you want by being present to the life you have. So again, it's about, there's actually daily readings. So kind of similar almost to like a devotional, like every day it might be a page or a page and a half that you would read. And it really just encourages, being present, and being aware and going through your day. So I think that that could be a great one for people that just want maybe a little bit digestible pieces of starting that practice of being aware and present. And then the other book is the one that I mentioned earlier, in our conversation. It's a big book. It's probably over 500 pages. It's also a little probably more technical. It's called Full Catastrophe Living. Don't let the title scare you. It is a little strange of a title. It is by Jon Kabat-Zinn. And really, it's about using the wisdom of your body and your mind to face stress, pain, and illness. We read this book in our class in our mindfulness-based stress reduction program, and it is used in medical centers worldwide.
Oh,
So
wow.
a lot of different medical centers use this book with their students and so forth. So a lot of information in that. And that's what I would say. Yeah, it's a good place to start.
This has been great. And talking about finding somebody with a calming voice, I will say your voice is very calming. I've been thinking about that throughout the podcast, how lovely your voice is and relaxing. On the yoga, so there are different types of yoga that patients can tailor to themselves, like chair yoga or just doing half the pose while you're doing the meditation piece. And always check with your doctor before you do start any type of exercise routine and make sure it's right for you. And I thank you
Absolutely.
so
Thank
much
you. Good
again
point. Yes.
for doing all that. And this is it for today's podcast. You have been listening to Bonafide HPP, the podcast of Soft Bones, the U.S. Hypophosphatasia Foundation.
Wonderful. Thanks so much, Cindy.
Thank you.
This has been a production of Bonafide HPP, the official podcast of Soft Bones, the U.S. Hypophosphatasia Foundation. For more information, you can go to www.softbones.org, or to recommend a guest to be featured on Bonafide HPP, email us at info@softbones.org.